Hi, I am Dr. Julie Brown, your trained concussion doctor, board certified chiropractic neurologist, and fellow in traumatic brain injury and rehabilitation. We happen to be filming this segment in March, which is Brain Injury Awareness Month, so I want to talk about the invisible injury. Many of my patients have not social issues, but they're really judged in their life outside of here with their brain injury. It's easier for humans to see a scar, a cut, a band-aid, a brace, a wheelchair, and realize that that person is injured. The tricky part with brain injury is you don't see any of that. They look normal on the outside. They're standing there, but they're maybe withdrawn. Maybe they're repeating something, and you're trying to figure out why do they keep repeating themselves? Did they not hear me? And we start to get a little more judgmental and say, oh, they have a bad personality or they're moody, when really it's just an expression of brain function. There's a lack of compassion for people to understand what this invisible injury is. I see it with spouses. I see it with parents to kids. I see it with kids and their friends. I mean, it is all around. I have a patient in particular who has been here, and multiple times her family members have tapped her on the head, not thinking about it. When you see a little kid and you're like, you're cute little, whatever, cute little kid. You have to be aware of that. It's those little things that can set off symptoms of their concussion again. So you have to be aware of the people who are injured around you, and they are not faking it. The other thing is I'm particularly talking about things that aren't a stroke. A stroke, you'll be able to see some paralysis possibly on it. I'm talking about concussion. Concussion is not seen on film. There's some things that you might be able to, but typically if it's not seen on film, that even gives it the understanding of a concussion diagnosis. And we call them mild traumatic brain injury, but it's not mild. It's mild in that it's not seen on film, but it's not mild in the symptoms that they have. And so that verbiage can confuse people as to what mild traumatic brain injury means and how they're acting like, oh, it's mild, they shouldn't, be having this issue. But it's real, it's very much there. I see it daily in my office. And I just want to bring a little more awareness to maybe how you can interact with those people in your life that might have a brain injury. If you would like to go to my website for anything, below is the link. And always looking for YouTube subscribers, and you can click here to subscribe.